The lines that I had here on my face prior to Restylane were deep, and I honestly didn't know what could be done about them. I hated the way they looked, and ever since I've had the treatment with the Restylane, right over here on my face, they're gone. I look much younger. I wanted to show off my new look to everybody, everybody from family to friends. I've had many compliments, and recently I've ran into some friends who I haven't seen in a long time, and the first thing they said was, "You look amazing," and of course they couldn't quite figure out what was different. My greatest concern before having any Restylane treatments was probably pain or an unnatural look. After my treatment, I was able to resume normal activities. As a matter of fact, I asked the doctor if I could work out later that day, and he said absolutely, and that's what I did.
The Restylane family of products includes Restylane, Restylane L, Perlane, and Perlane L. These products can be used to add volume and fullness to the skin to correct moderate to severe facial wrinkles and folds, such as the lines from your nose to the corners of your mouth, nasolabial folds. Restylane and Restylane L may also be used for lip enhancement in patients over 21 years. Ask your doctor which is right for you. Important safety considerations for the Restylane family of products. Products in the Restylane family should not be used by people with previous bad allergies, particularly to microorganisms known as gram-positive bacteria, or by people with serious allergies to drugs that have previously required in-hospital treatment. These products should not be used by people with bleeding disorders. Products should not be injected anywhere except the skin, just under the skin, Perlane and Perlane L only, or in the lips, Restylane and Restylane L only. Restylane L and Perlane L should not be used by anyone with a known allergy to lidocaine. Use at the site of skin sores, pimples, rashes, hives, cysts, or infection should be postponed until healing is complete. In these instances, product use could delay healing or make your skin problems worse. After treatment, you might have some swelling, redness, pain, bruising, or tenderness. These are typically mild in severity and normally last less than 7 days in nasolabial folds and less than 14 days in lips. Swelling may be more likely in patients under 36 years, and bruising may be more likely in patients over 35 years. Rarely, the doctor may inject into a blood vessel, which can damage the skin. Although rare, red or swollen small bumps may occur. If you have had facial cold sores before, an injection can cause an outbreak. To avoid bruising and bleeding, you should not use the products if you have recently used drugs that thin your blood or prevent clotting. Products should not be used during pregnancy, when breastfeeding, or in patients under 18 years for nasolabial folds. Treatment volume should be limited to 6.0 ml in wrinkles and folds, such as nasolabial folds, and limited to 1.5 ml per lip, Restylane and Restylane L only, as greater amounts significantly increase moderate and severe injection site reactions. The safety or effectiveness of treatment in areas other than nasolabial folds and lips, Restylane and Restylane L only, has not been established in controlled clinical studies. The Restylane family of products is available only through a licensed practitioner.